Hello, and welcome to this presentation on algorithms. My name is Christine Roberts, and I'm a graduate student with the University of Texas at Arlington's College of Nursing. This presentation was designed to provide you with an overview on what an algorithm is and how it can enhance the learning process. This video is in partial fulfillment of the requirements for Nursing 5309 Teaching and Learning Strategies. Roles describes an algorithm as the process of breaking down a complicated task, process, or procedure into singular yes or no steps. This step-by-step process allows the student an opportunity to critically think about the procedure's steps in order to arrive at a final destination, conclusion, or action. One of the great things about algorithms is that they can be used by anyone. They can be used by nursing students and by nurses in the healthcare setting. Let's take a look at a skit demonstrating the benefits of using an algorithm to enhance the learning process. The skit will include myself as a staff development educator at a local hospital and Brenda S. as a new nurse who's having difficulty interpreting her EKG rhythm strips. At the end of this program, the new nurse will analyze an EKG rhythm using an algorithm. She will determine if the EKG rhythm is a second degree type 1, second degree type 2, or a third degree heart block using the algorithm. And she will identify an algorithm that is currently being used in her practice. Oh, hey Brenda, come on in.
Hey, Christine. I need a big favor.
Okay.
So I've been studying for my EKG test, and I'm a little concerned. I know my definitions and I know my rationales, but I am very confused on these heart blocks. Is there any way you can help me?
Not a problem. You know, heart blocks are always a challenge for everybody when they start to learn them. But I have a fantastic tool for you to use to help you interpret these heart blocks.
Okay, sounds great.
Are you ready?
Ready.
Oh!
Oh, this looks really confusing.
It does look a little bit intimidating, but this is what we call an algorithm. And this algorithm takes us through 3 easy steps, answering yes or no questions that help you decide whether or not your EKG strip is a second degree or a third degree heart block.
Okay, I'll definitely give it a try.
Give it a try?
Yeah.
Okay. Do you happen to have an EKG strip?
Actually, I brought one with me.
Excellent. Way to go. Okay. So, let's start at step 1.
Okay.
Are there more P's than QRS's in your rhythm strip?
Yes, ma'am, there is.
Okay, so according to the algorithm, if you answered yes, then we're going to continue on to step 2.
Okay.
But had you answered no, then this would not be considered a second or a third degree heart block.
Okay, that seems pretty easy.
Okay, pretty straightforward?
Yeah, I think so.
All right, let's carry on to step 2. Okay, step 2. Is the PR interval always the same? Is the length always the same?
Let me see. No, it's not.
Okay, so according to the algorithm, if you answer no, we're going to continue to step 3. But if you had answered yes, if the PR interval was always the same, then this would be considered a second degree type 2 heart block.
This isn't so bad.
It's not so bad. No. You just follow the steps.
Okay, sounds good.
Okay, ready for step 3?
I think so.
Okay. Whoop. Losing our algorithm. All right. Step 3. Is the R interval always the same? Does it march out?
Yes, it does.
Okay. So, according to the algorithm, if you answered yes, what type of heart block would this be?
Third degree heart block.
Third degree heart block, a complete heart block. But if you had answered no, this would have been a second degree type 1.
Okay. All right. Now this made it much easier.
Okay.
This was a very simple step-by-step. This is exactly what I needed. This is fantastic.
Yeah, algorithms are great. They're kind of like a roadmap helping to guide you along your decision-making process.
Okay.
They're used in many different places throughout the hospital and healthcare settings. One place you might have seen it is in BLS and ACLS classes.
Oh yeah, I remember that.
Mm-hmm. You know, you come up to the mannequin, are you okay? Yes or no. If no, then are they breathing? Yes or no. So it really takes the process and splits it into different steps and then a yes and no answer for each, and then you do what you need to according to the algorithm.
You you know what, I think we just got a brand new asepsis protocol. And it's an algorithm, so now I know how to read it.
Exactly. It takes you through different yes or no questions to determine if your patient is septic or not, and then it tells you what actions you can take to help the patient. So yes, you're right.
Well, I want to say thank you so much for making this so simple and making it a step-by-step guide. I greatly appreciate your time.
You're absolutely welcome. You know what? Why don't you take a copy of this with you?
Oh,
here you go.
Are you sure?
Absolutely. I have hundreds of these.
Oh.
There you go.
Okay.
All right. You can see how beneficial this algorithm was for helping the student to distinguish between second and third degree heart blocks. She drew on her previous knowledge of EKG strip interpretation to correctly use the algorithm. She also used critical thinking in each step of the algorithm to make her decisions and guide her interpretations. This algorithm is simple, it's easy to use, and it guided the student step by step through the decision-making process. Algorithms are used to enhance learning, promote safety, and guide actions both in the healthcare and the academic environments. Rathbun and Ruth Sod state algorithms provide nurses and students with guidance by breaking down tasks into simple yes or no steps. These simple steps allow students to use critical thinking to guide them in both their decision-making processes and their courses of action, while also simultaneously increasing their competence. Please feel free to seek more information about algorithms using the following references from our presentation. I hope you have enjoyed our presentation on algorithms and the many ways that they are beneficial to help the learning process. This is Christine Roberts for the University of Texas at Arlington College of Nursing, and I thank you for watching.